most qualified people to be able to talk to the advantage of the Advocacy Center in its completion, how it could help the kids and help their families.
Well, you know, I have done this this area for a long time, and it's a rewarding area. And one of the great things about it is that we've seen how to improve the services that we provide to children. And the first phase of the Child Advocacy Center has been tremendous. It's been really a wonderful experience to be able to provide a better environment for children and their families. That first phase is one step, and it's a tremendous step, and we thank everybody in the community for getting us there at all levels. You know, private people have made tremendous donations through the Friends of the Child Advocacy Center group. We've also had tremendous government support, local government support, state government support, and federal government. And Prosecutor Valentin has been supportive of it, and it's just been tremendous. But we also know that there are additional steps. Over the years, we've learned, we've been informed, we see nationally all the things to do to get better at how we handle these cases, how we handle these families, and all the things that we can do for them. And
one of the things I think that's the most important about the center that you can attest to is that, you know, when you tell a story and then you tell another story and you tell the same story over and over and over, the story is likely to change. And one of the things that you need is to have everybody in the same place to communicate effectively and have the child not have to tell that story more than they have to.
That's exactly right. It's a tremendous advantage for us and for the child and for the results that come from the child making their disclosure. It's a hard thing for a child to disclose some form of abuse. And what our center, what the first phase has allowed us to do is even improve how we do that thing where when the child's interviewed, everybody can come to that one place and the child only needs to be interviewed one time. Sometimes we find that, you know, when children are interviewed over and over again, that we're unintentionally sending them a message that maybe they should be saying something different. Maybe what I'm saying isn't right, or maybe
they want to please you.
Right, and they do. When they do, they want, and they also, when they come out with it, you know, I mean, all kinds of child abuse is so secretive that when they've come out to the right time, that they come out with it, we need to respond properly to that and address it and listen to them and do it the right way. They do want, you know, for whatever reason, whoever it is that they told, a teacher, a parent, you know, whoever it is, a police officer, they want, you know, results that should come out of that. They want whatever motivated them to tell at that time. And when we talk to them just one time and we listen to them, that's really what we want to do. We want to do that better and better and give them that opportunity.
So if you were talking to, and you are talking to so many people out there, you know, about to make a donation or about to decide how much they're going to donate or about to decide if this is the group that they want to donate to, just quickly, what would you say to them? What would you say to them and what they are about to do with their money?
Well, the first thing I want to do is I want to thank them for their response, for their being attuned to the children of Monmouth County and everything that it means to help this type of child, because these children are our children. You know, children that are abused, it doesn't happen. As I was driving in, I heard you mention, this stuff happens everywhere in Monmouth County, and that is a very important thing to remember. It's not just somebody else's child. It's not just somebody else's concern. The other thing is that we want to focus on and we want to do our best to treat a child like you would want your child treated. And that's what we think that the first phase of the Child Advocacy Center has done for us in giving us a place to do some of that. And then the second part, that second phase, we want to do it better. We want to have a place where instead of a child maybe having to go to a hospital environment to have a physical examination if they need that, then maybe we can take care of that in the appropriate cases at this location. We want to have the ability to have some mental health professionals be present and to have appropriate locations for them to do some of their job. Now, at least certainly at the earliest phases, that's so crucial, and we want to be able to offer that, and we'll be able to do that with that second phase. And also, as Liz pointed out, the improvements that we can make in this and handling these things is to have everybody together. And so we also want to have, right now, we're so happy with the first phase of the Child Advocacy Center, and we have everybody coordinate that they all go to one place so the child doesn't have to rattle around to a bunch of different places. But what we know from nationally, what other people tell us nationally, is that when they have the ability to what they call co-locate, that everybody works in the same place, that's an even better improvement in how everybody coordinates, and everybody, instead of being concerned about getting there and being concerned about what their boss says, about what their job is, and taking care of their piece of it, is that they focus on all working together for that child, and that's the next step. And we're so grateful for people that are listening, and there are people that are helping us at every level and every way to get there.
Just to get some concept, and it's a very difficult concept to grasp, just to get a concept of how often child abuse is reported in Monmouth County. I don't want to put you on the spot with specific statistics, but it happens. Is it safe to say that it happens on an average day multiple times in our county?
There's no question about that. One of the biggest challenges about child abuse is that it happens and it doesn't get reported. But as we get better at it, and as people know that the response is better, that it is not what they're worried about. Oh my goodness, if I report this, they're going to have my kid's going to have to talk to a big mean cop, or they're going to get bounced around from person to person to person. So as people get more aware of that, and as professionals who get a lot of these responses are more aware of that, we get more and more reports. We don't necessarily believe that there is more and more and more child abuse over the years. That's unfortunate that there already is that. We believe that there's a lot more reporting. We have upwards of 800 that we deal with in the prosecutor's office with our specialized detectives every year. So we're talking about multiple per day, every day, in and out, that are coming to us, and we know that it's just a fraction of what happens out there all the time.
So just based on even that statistic, from the time the Radiothon starts till the time it ends at noon tomorrow, on the average, you'll receive 3 reports in Monmouth County.
We'll probably see at least three children at the Advocacy Center. One of the great things about our new facility and what's been provided by the dedication that people in this county have already is that we've been able to accommodate multiple people. We have multiple interview rooms, which we didn't have previously. We have multiple waiting rooms. We can give people the privacy and dignity that they should have, as opposed to having to sit in the same waiting area or sit in a hallway waiting. All those improvements are just tremendous.
Well, it's a wonderful start, and now we have our work cut out for us to finish up phase 2. Peter Boser, thank you so much, and on behalf of all of us, thank you for your work, because your work is the kind of work that most people would not be able to do, and your effort on behalf of the children is really appreciated.
I think that, thank you. I think that those of us that work in this area all take our inspiration from each other, from the dedication that we all have. I don't do much. There's dozens of us who do this stuff all the time, and the only way we can do it is by doing it together. And there are tremendous people who are so dedicated. There are a whole lot easier ways to, for certain people to have jobs. The detectives, the assistant prosecutors, the support staff, the DIFAS workers, the mental health professionals, everybody's connected, medical people. They're in every one of their disciplines. There's an easier job that they could have. And the only people that do this day in, day out are the ones who are willing to do it. And it really is an inspiration. And I'll tell you, that's what makes it an easier thing to do.
Yeah. And we love talking to you. We'll have you back on hopefully later today.
Great,
thank you so much. Now also, Terry Loftus is here with us. Joe Spano and the foundation has already this hour donated $25